Okay, well, here we are. Good morning. So I'm going to ask each of you to introduce yourselves, and so then we'll talk about some of the topics that we're finding in healthcare today. Okay, so go ahead.
So my name is Tanya Andrews. I'm a human resource generalist at Presbyterian Medical Services Hospital, with both. And I've been with Presbyterian for almost 2 years now. Always in human resources. I've been in a couple of different facilities, but in human resources for over 20 years, primarily in recruitment.
So my name is Ray Houdin. I'm the manager of talent acquisition for CHRISTUS St. Vincent's, and I've been with CHRISTUS now for over 7 years.
7 years, wow, that's a good long time. And I'm Jasmine Holmstrup, and I'm the Chief Development Officer with La Familia Medical Center, and I've been there since September of 2020. I came in the middle of the pandemic. Boy, was that a transition. And I moved here from Dallas. So Santa Fe to Dallas, that's been Dallas to Santa Fe, that's been an interesting transition itself. So you know, obviously we're here to talk about hiring. And I think that, you know, one of the biggest things that we all are finding and that everybody's talked about happens to be the Great Resignation, right? So, you know, let's just dive in and let's talk about where we're going with the healthcare community, the healthcare industry first, you know, as to what's going on and everything. So
of course. So we continue to find challenges every day. It's we're trying to compete. There's many great opportunities out there, and we just are here to represent and to support our community in any way that we can. And we're looking for great candidates to hire and to take care of the patients that we're facing.
How many patients does CHRISTUS see?
Throughout, like our census today was probably over 172 patients, and that's just in the hospital. That's not including our clinics. Mm-hmm. So we can see up to you know, through our ED over 2,000 patients in a month. It's very busy.
That's very busy. That's very busy. Now, Presbyterian is much younger here in Santa Fe. But what are you guys finding? You know, what's the trend in the healthcare industry for you guys? I mean, both in primary, but also in the hospital itself.
Well, I think that it's a challenge when we are faced with giving candidates an opportunity into an organization, into a job field that they're not familiar with. You know, maybe aside from the job shadowing and the interviews and all of the predisposure they have prior to being offered a position and hired, once they get into that position, they realize that that's not necessarily the job field that they want to be in. And so that's a challenging factor for us right now, is, you know, making sure that we are pairing that candidate with the right opportunity. Making sure that it's a fit for both, you know, so that they're successful with their endeavors that they pursue with us.
Now, I just do want to ask, because we're all in healthcare, and you know, I know that, you know, I would be remiss if I didn't address the pandemic and how the pandemic affected your, you know, your staff. I mean, I know that for La Familia, we found that it was very, very challenging in that, you know, we had to pivot partially to telehealth, but we also, you know, had to maintain the safety of our patients and our staff and everybody, and it really created a lot of burnout. Did you all find that?
We did. Even with when it came down to new grads, trying to convert them, a lot of them changed their mind, and they had just graduated into the nursing field, and they just decided this wasn't for them. Mm-hmm. So we had to bring in travelers and contractors to help fill these positions that we had vacancies for, and it's continuous. You know, we're trying to compete every day to provide a service and also help our current staff so that they can have time to spend with their families and get that break that they need to recover.
Likewise, we have felt the burden. You know, maybe individuals who have been with the industry for quite some time But this is the first pandemic and challenges that they faced,
Mhm.
and wanting to be there for their family and take more time off, or maybe drop pointage, or an extended leave of absence to take care of their own personal needs. So we have felt the same challenges in filling those vacancies with travelers and contract staff as well.
So when you guys mention travelers, just because, I mean, that's not something that La Familia can do, or we have not done. Where are you finding those travelers?
We work with other organizations and agencies
Okay.
who have staffed
Okay.
those positions, and we work with them directly to say, look, we're looking for a 6-month contract for these 5 nurses in this specialty, and contract through that agency for them.
But the same, it's, we work with over 75 agencies, but it's something that's not sustainable with the rates, and but we have to do what we need to do to provide care to our patients and also relieve the staff. But it's something that a hospital cannot sustain.
Yeah.
So we're decreasing numbers. One time we were at 150 travelers, and we're down from that. So, and also the rates, at one point the rates were over 200 per hour. So you have to balance that, and I'm sure other people are starting to balance out and not have as many travelers there to help. We are recruiting, and we're here to recruit. We work with many colleges throughout the community to recruit and build a stepping stone for them.
Well, I know one of the things that we're finding, onboarding has been an issue. Maintaining our staff has been an issue, trying to keep our staff happy. And, I know that we also, we've got 2 residency programs, and we also do a lot of externships. But, La Familia is a slightly different model than the hospitals in that we're primary care and dental. So, we've got the medical, the dental, behavioral health. And so we are struggling because we cannot pay those higher rates since we're a nonprofit organization. And it's been difficult for us because we're competing against you guys for nursing and for medical assistants and for providers. And so considering that, what other resources, are you all using aside from the outside? Where are you looking in the community here? I mean, how do we address that? Because, obviously it's impacting the care, not by choice, but it's impacting how quickly people can get in, getting a primary care provider. So Tanya, can you just, address a little bit some more of the stuff about what Presbyterian is looking for as they go out and hire?
Well, we're launching a lot of efforts right now into our hiring and the recruitment, whether it be online and through social media, as well as in-person job fairs now. And I hope that, with the pandemic surge now, being relaxed, and the in-person, that we'll get some more traffic and be able to show people the facilities and give those tours and talk face to face again. I think that's a huge difference. If all of our communication thus far has been virtual and via Teams or Zoom or whatever the platform is, I think it's hard for the individual to really understand the organization and who we are, who I am, and their potential hiring managers and peers that are also conducting these interviews with them, if it's all virtual. I think to be able to shake a hand and walk you around the facility that you're going to be potentially working in, I think is going to speak volumes once we start making those efforts here now. So
Yeah, you're right.
So we're glad that we're able to do a lot of in-person. It was very challenging to make that connection virtually. So, bringing them in and starting internships and building a stepping stone for them wherever they start, whether it's level entry or a licensed profession, having those resources for them to continue to grow within the organization helps retain and building that relationship with them. You have to reach out to the community and let them know that you're there and and can provide, and we need their help. And
You mentioned something that was very important in not only building the relationships, but also giving them a career path for advancement. You know, and so talk to me a little bit more about how you all do that.
so we provide a nursing residency program to help them, especially with the new grads that are just graduating from college and starting their career. So we help them there. Throughout the hospital, we have for the laboratory, for start out as a nursing assistant and work their way up to an MA, certified nursing assistant, and onto nursing. You have to either to provide that to them and know that you're investing in them. So.
And Tanya, you know, I would hope that Presby, but you guys, I mean, Presbyterian, not only being here in Santa Fe, you have a much broader reach. So are you able to bring folks in from, you know, like, let's say from Albuquerque or from Española, from the other areas? How are you all handling the advancement opportunities?
Really well, actually. Once we can get those candidates and hire the individuals into the programs, the advancement opportunity is endless in any field, you know, whether it's radiology or pulmonary, nursing. We want them for longevity. We want them to be with us forever and a day. And if their career advancement leads them down those paths, we have all the opportunities and support from, you know, our CDS in Albuquerque and our other regionals, so that if we can't do it here, we'll do it there, or vice versa, and make sure that the individual gets down the path that they need to be in.
I know we actually are La Familia, considering that we're much smaller than you all. I mean, we only have 200 employees, you know, and so we have also just started a real career advancement program within our organization so that we can bring those folks in and give them a career so that, you know, we want to keep them there for a long time. We have many employees who have worked with us for 20 years as dental assistants, as medical assistants, as nursing assistants. But, you know, I mean, obviously you all offer bigger, greater opportunities. You know, a lot of people are talking about remote work. And, you know, in healthcare, and I know that within La Familia, we have opportunities for admin, you know, if you're doing administrative work, or if you're doing, you know, like in my field is the fundraising and marketing, it's easy. But, you know, I mean, are there opportunities for remote work within your, you know, organizations?
Yes, definitely. And we advertise, you know, if it's 50% remote or 100% remote, but that's a very frequently asked question is, can this be done remotely? Before they even, you know, want to talk about an offer, and that's in the very beginning at the interview stages. And so, yes, absolutely. We want to make it comfortable for both the candidate and for the company. And so we have about 23 open positions right now that are remote. If not 100%, you know, 50% of what they're doing is remote.
On our side, it's more like on the billing administrative side that those are remote. But a lot of our positions, we want to be there to support our staff, you know, for our nursing and licensed, but we need to be there, licensed professionals. So it's just depending on the position and what we do offer.
Yeah, I know a lot of people ask, I mean, even as we're looking, you know, I hired a marketing coordinator a couple of months ago, and the words were, how often can I work from home? And I'm like, you know, I wanted to be able to support, but at the same point, you know, I want people to be in the building and see and learn, you know, so it's a fine balance. I mean, I think that the pandemic has really taught us that, you know, there are certain things we can do and certain things we can't do from home. So, you know, one of the other questions is, you know, as obviously as we're talking about, since we're not able to have full staff, how are we meeting our community needs. I mean, I know that La Familia has struggled because we have 17 positions out of our 200 that are open. Several are medical professionals, providers, physicians. Others happen to be, you know, nursing, medical assistants. But, you know, speak to me a little bit about how CHRISTUS is addressing, you know, people not being able to get in, the long waits.
So again, we're still catching up from the pandemic for services in regards to surgeries or whatever. But I think what happened was we were able to provide. It was just that our patients were scared to come in and get the services that they needed. So they waited too long and they just got sicker as the pandemic went through. So now we're trying to catch up and we're doing well. You know, I believe that the longest wait is 25, 30 days to get in. And we did all that we could, you know, whether it was through virtual visits or whatever, to reach out to those patients that we needed to. I think we're getting better.
Our wait is about the same. It's about 30 days out for a primary care visit. Specialties are a little bit different, but we face the same challenges with individuals who didn't seek care. And now that they need care, there's a little bit of a wait, but the telehealth has saved us. Being able to offer that as an option for those who didn't want to come in during those times, and still now we're maybe a little leery. So that is definitely been a plus for us. But, you know, making sure that we're staffed the best that we can so that our patients can come in and being able to serve them where they need to.
We're finding, I mean, we, like you all, we are definitely finding that our patients put off care. I mean, you know, considering that 40% of La Familia's patients are uninsured and underinsured, they definitely, you know, they couldn't afford it. And so now all of a sudden we're finding a lot of unmanaged diabetes, hypertension, obesity, and new diagnoses of cancer. And, you know, and that's a real struggle because you want to be able to help take care of those patients, especially when they, you know, are struggling financially. So that's, you know, I mean, but the other issue that we found, especially during the pandemic, was the issue of childcare. And how are you all addressing that? And how has that impacted, you know, staffing at the hospital?
It's definitely a topic of conversation. Individuals who struggle with that and, you know, maybe having to take off certain days of the week because of childcare challenges, or, you know, their child, you know, can't go back to the provider, you know, their daycare provider for 14 days or 10 days. And so right now we're surveying our staff to see what the need is currently. And is it a 24-hour need? Is it a 15, you know, hours a day, and what that looks like, so that we can work with our agencies and see what's out there, what needs to be out there, and maybe help other entrepreneurs follow the path of opening up that childcare that needs to be 24 hours a day, or open at 5:30 a.m. instead of 7 p.m. So right now we're really digging into the root cause of the childcare and how we can meet the needs of our staff.
As well as we're open to discussion and trying to serve our staff members in any way that we can to help them so that they can be present and not have to worry about those issues. So it's in discussion.
We found that we lost a number of our staff specifically because of childcare. And it's been difficult to get them back. And, you know, I know that, you know, many of our employees are younger and have younger children. And, you know, not having vaccinations, the vaccines for those under 5 is also complicated things. And so, you know, I know that we're looking to, we do not want to open our own daycare.
Neither do we.
I mean, that's something we don't want to do. But we definitely want to figure out opportunities and be able to support those staff who need to, and figure out what, you know, how we can help. So, Tanya, tell me, how does someone find you and where should they look if they want to come work at Presbyterian? What's the best way to reach you?
Call me. I'll put my phone number everywhere, any social media, email. I'm accessible 24 hours a day, just about. You know what I mean? You know, we have our phones on us all the time. The Presbyterian Careers will give you an opportunity to see absolutely every position we have in our entire organization. You can filter it out by location, specifically to Santa Fe, and then you can start filtering to pay, to position specific, pointage, whatever it may be. But available to talk all the time and review any opportunities that might come in individuals' way.
Now you have how many positions open?
82 today.
82 today. Okay.
Yes.
And you gave me a big number as we were talking about it. So talk to me about CHRISTUS. How can they reach you and how can they find jobs?
Of course. So we have our website, of course, and all our contact information for my talent acquisition team is on there. We're always available. We're always here to help you and any questions that you have, applications, what we can do to get you there. But we're available. So,
And you have 300 positions?
Around 300, yes.
And those are all different levels?
All different levels, yeah.
Okay, so
And some of those we're in the process of working through as well. They already have offers out, but they don't close out until
and pay differential. I mean, have you all changed your pay scales because of the pandemic? Yes.
we're trying to be competitive, and also with the housing going up, that doesn't help us at all. So we're always having to adjust and make sure that we're coming to.
Yeah, I mean, are you finding that your employees are coming from areas other than Santa Fe?
We polled a couple weeks ago, and less than half of our work staff work in Santa Fe. So they are coming from all around, as far as Las Lunas, in fact.
Oh my gosh, that's a long drive,
Right.
to get to. Oh, I wouldn't want to do that.
Railroad.
Yeah. Well, I know I have staff that come from Albuquerque, and then, all over, but that is definitely an issue that we have to address. I know that we have changed our pay scales as well. We can't compete with you all, I mean, being a nonprofit, but we definitely are able to, we have looked at, how can we, keep our employees engaged, and obviously salary is one of those, pay scale is one, especially when you think about right now, what is Target paying? I saw something recently like $18 an hour to work at Target. And, and that's not a career. But, when you think about someone who's working in administration, you've got to figure out how to, And the other thing I wanted to ask about, because this is something that, a lot of, as we're talking about Target and all of those, man, since we talk about careers in healthcare, let's talk about the benefits. Because I think that that's one of the things that people don't recognize is that once you get in, we give you the career advancement, but we also have the benefits for everybody.
So what we do is we try and break that down.
Okay.
And show the comp structure and all that it involves and includes to help build that package for them. But it's also selling the organization and letting them know what we're all about, our culture, what we have to offer, all that we do to support our staff, and help them grow, to stay with us, and it shows, we have staff members that have been with us over 45 years that are still with us, so they're committed and they know that we're here for them. So
That's awesome. And then as we obviously the benefits of working with the Presbyterian.
Great benefits packages for anyone who is interested in opting into benefits. And the great thing about our benefit, if they're opting in, they're eligible day one. So day one, those benefits are available to them. including PTO. They earn PTO day one, we give them 16 hours. Here you go. In case you need this right now, you don't have to earn it. We're gonna put this into your bank for you. And that's huge.
It
You
is.
know, that is, our benefits, they're great packages that our workforce is able to opt into. So definitely it's not just the salary and the expectations, but you know, we're building that relationship with them and longevity and showing them that, you know, this is your workforce family.
Mhm, mhm. And no, actually, all three of us, all three organizations, and you know, because one of the other things that I think that we don't tout enough, you guys have it on your building, but I'm not going there. We all have won awards for workplace environment, for being best, you know, places to work. And I think that speaks to, you know, the important, I mean, that tells people, hey, come work for us, because that's, you know, we care. I mean, it's not just about healthcare, it's really about our employees. So, you know, I mean, anybody who watches this should know that all three of us, all, you know, that CHRISTUS, Presbyterian, and La Familia really are focused on, are family focused and also employee focused. So, you know, I want to make sure that people understand that it's not, you know, because you hear horror stories, but that this is a great place for, you know, that these are great organizations for people to come work. So, well, any last words from you?
Presbyterian.
Right, now your turn.
Thank you for having us here today. It was nice meeting with you. First, if you have any questions, please feel free to reach out.
And, you know, and I just appreciate getting to spend the time with both of you this morning and be able to have a conversation, and, you know, hopefully we'll be able to, you know, fill those positions, because healthcare is so important in this